numbers and some business support. And then Jerome will take questions about health matters. I'll take questions about business and other matters. And we do have we've got an hour before we have to be at other things. There are 23 new cases in today's numbers, 21 local and 2 interstate acquired. 2 cases are in hospital. 45,408 people were tested yesterday and 25,418 vaccinated in state clinics. I think about 55,000 all up, so that's a great number, second highest daily vaccine number for the year. In terms of business support, we have been once again in extremely fruitful conversations with the Commonwealth. Over the last 24 hours, the Premier and the Prime Minister had conversations yesterday, as did Treasurer Pallas and Treasurer Frydenberg. And we are very grateful for the ongoing spirit of cooperation in which the Commonwealth is approaching the matter of business and income support, and it allows us to provide the package that we are announcing today. So in recognition of the fact that the regions are open at this stage, this is a package of $367 million to support more than 100,000 predominantly metropolitan Melbourne businesses affected by a second week of lockdown. We have put $1.4 billion plus into bank accounts since the May-June lockdown commenced. So that's the benefit of the automatic payment process that we are undertaking for the vast majority of businesses that are receiving our support. There are 3 key elements of the package, 2 of which involve automatic payments, and the third, a further boost to the hardship fund, which I'm pleased to say will open today. Under the Business Cost Assistance Program Round 3 Metro, there's an additional $271 million for $2,800 grants to recipients of previous recipients of the Business Cost Assistance Program. That includes gyms, cafes, restaurants, catering services, hairdressers, dance and swim schools, tourism businesses, event businesses. Those payments will be made automatically, and we would expect that to occur within the next week. There is an additional top-up of the Licensed Hospitality Venue Fund of $55 million, and again, that will be automatic. We have adjusted that those grant amounts in response to some feedback we've received in the last week about those restaurants in particular in the 100 to 200 seat range. So the threshold for the $10,000 grant is being reduced from 199 to 100. So for all of those with between 100 and 499 patrons, the payment will now be $10,000. It was previously $5,000 up to 200. So it's $5,000 up to 99. $10,000 for between 100 and 499 and $20,000 for venues with a capacity of 500 plus. So for those venues in that 100 to 200 range, that's an additional $5,000 in this week's package. We've also added $41 million to the already announced Small Business Hardship Fund. That was $139 million. That goes to $180 million. That will allow grants now of $10,000. It was previously at $8,000, and that will support up to 18,000 businesses across the state. That is a flat rate metro and regional, in recognition of the fact that they are businesses who have not previously been eligible to apply for support programs and have suffered severe impact. So to put that in some context, we're talking about businesses which have been allowed to trade, but which have been severely affected nevertheless. So for example, takeaway businesses that operate in closed sites like shopping centres, businesses that have been open but their customers have been closed, for example wholesalers to cinemas, tradies who can demonstrate that their work is in indoor restricted settings, businesses that have been severely impacted by restrictions that limit foot traffic, like pharmacists in the CBD. They are merely examples, but they are the sort of businesses that we believe will be able to demonstrate that significant reduction in turnover and are registered for GST. In regards to the COVID-19 disaster payment, the release that you see from Treasurer Frydenberg, Treasurer Pallas and myself makes clear now that businesses that do not qualify for Victorian government support, as well as metropolitan workers who lose hours, are eligible for those payments. That is now to the extent that there was ever any doubt, that is now crystal clear. $450 for 8 to 20 hours lost, $750 for 20 hours or more lost. That is administered through Services Australia, and importantly, I think you might recall at last week's press conference I indicated that there was some concern that there are people who are on other Commonwealth transfer payments who had previously been, as a consequence of that, ineligible for the disaster payment. That's now been tweaked by the Commonwealth so that if you are in receipt of a Commonwealth transfer payment, you can receive an additional $200 a week as a disaster payment on top of your Commonwealth welfare payment of whatever sort that is. So that is the nub of the package we're announcing today. As I say, $367 million in total. That important change for those medium-sized hospitality businesses. That increase of to $10,000 for the hardship fund for those businesses who have been unable to obtain other support, and the fact that that fund will open for applications today. I'll now hand over to Jerome, and then we'll take questions.
Thank you, Minister, and good morning, and thanks also to Mark and the Auslan team. I've got quite a lot to get through, so Mark will be quite busy. 23 new cases today in Victoria, 2 of which are interstate, which I'll talk about in a moment. 2 cases, or 2 people currently in hospital, and of course we send our best to anybody recovering from coronavirus in Victoria. 137 active cases of COVID in the state. We now have 330 exposure sites, excuse me, and 13,700 primary close contacts across our outbreak. We managed to clear another 253 people yesterday. I might start with vaccinations today. Not only did we do a really high number of vaccinations yesterday, over 25,400, but over the last 3 days, first 3 days of this week, 9,600 people came forward to get their first dose of AstraZeneca. It's really good to see that's a 3-fold increase of AstraZeneca take-up compared to last week, the same 3 days last week. We have another 11,600 people booked in for their first dose of Astra for the remainder of this week. Now, can I just thank everybody who's coming forward to get vaccinated. We have in total across both Pfizer and AstraZeneca first and second dose, almost 250,000 bookings already made over the next 4 weeks, 248,164 for those who want the detail. But we also have around 240,000 appointments left over the next 4 weeks, primarily AstraZeneca, but also significant amounts of Pfizer across our 51 state clinics. I would please urge now all Victorians, it's time to get our vaccination journey done. We have significant numbers of people who have been eligible for a while to get vaccine, both Pfizer and AZ. We would really like you to come forward and get it done. And for those who are newly eligible, particularly those under 39 for AstraZeneca, please have that conversation with your doctor and with anybody else you wish to consult and make a decision that's right for you, recognising we all need to get vaccinated as soon as we reasonably can. In terms of the 21 local cases today, 15 of those were in quarantine for their entire infectious period. We have 10 of those cases associated with Altaqua College, 3 staff members, 1 student and 6 household members. They are all otherwise well, and they were all in isolation for the duration of their infectious period. We have 4 people associated with the Newport Footy Club exposure, 1 player and 3 household contacts from various connections. 3 of those people were in isolation, 1 is a new household contact. And we have 3 people from the Caroline Springs shopping centre exposure area, all household contacts, 2 of those were in isolation. All those 17 cases I've just gone through were linked, and as I said, 15 were in isolation. We have 1 new case, which is a man from the inner north. He has some social connections to some of our exposure sites. We haven't yet ascertained the exact link. That work is going on. I expect us to be able to link that in the next day or 2. That takes us to 18. We then have, and probably the most interesting cases for today, 3 cases across 2 entirely separate and unconnected households in Glenroy, who are positive. We have no acquisitions source for them at this point in time. Obviously, a lot of work happening with those 2 separate families. One of them is a child who attends Glenroy West Primary School. We are, of course, working with the school, as we have done with a number of schools in this response, to get them all tested and to ensure that we rapidly establish acquisition source and any other onward connections. You may recall yesterday I did speak about some wastewater detects, which included Glenroy. That was prescient. I therefore urge people to please, we're continuing to see wastewater detects in the Glenroy to Broadmeadows area. It's a very large catchment. It includes a number of different suburbs, including Essendon Fields, Roxburgh Park, Strathmore, Jacana, and Broadmeadows. There are others. I would please urge anybody in that outer north suburb area, in those suburbs I've just mentioned, if you have any symptoms whatsoever. We have active cases of COVID in that area that we now know about. We are very keen to establish any other cases that might be out there as swiftly as we possibly can as we try to run all these outbreaks to ground. There are at least 23 different testing sites across the northern suburbs within a sort of a 10k radius of Glenroy. We please ask people to make good use of those testing sites. Obviously, a lot of activity happening in that space. In terms of yesterday, I mentioned 2 cases that were unlinked cases, mystery cases. I'm pleased to confirm that both cases have now been linked genomically to the outbreak that we're dealing with. So the genomics lines up to this wider Hobson's Bay kind of cluster that we're working through. The City of Melbourne father and son pairing, we continue to work with them and continue to test the school community at St Michael's Primary School. We've also got a couple of apartment buildings that we're doing a lot of testing on. That work continues. Again, we have a number of other leads to follow up epidemiologically, but the genomics links it very clearly. Similarly, the family of 3 in Melton are all but linked. Again, we have a number of very strong connections that we're just trying to finalise. We now have 25 exposure sites listed in the Melton area, and we really need to see a continued strong drive for testing in the City of Melton. I'm really pleased to see we've seen an 8-fold increase in testing levels in Melton last couple of days ago compared to a week before. So 6,600 tests done on Tuesday just in the City of Melton. So we're really seeing that whole community come out in force to get tested. My thanks to you for doing so. It is really important that we land this one and understand if there's any other onward transmission. We're confident at this point that we think it's a downstream transmission again from the Hobson's Bay cluster, but we need to use this opportunity to really get our hands around it. We have boosted capacity at testing sites across the whole West area. We're adding a new testing site, went live this morning at the Melton Seniors Community and Learning Centre. That was already very busy this morning, so please, if you are coming out to get tested, if you're coming out this morning, check the sites and the waiting times before you go. Find the sites nearest to you that are not as busy as the other ones, and I'll talk about that a bit more in a moment. Now, the 2 interstate cases today are really a salutary lesson in the risks of interstate travel at this point in time. We have 2 women who travelled together on Monday, the 9th of August, so Monday just gone, who flew in from Sydney on the QF 471 about 5 p.m. And arrived in Melbourne. They did not have the right permit with them. No permit would have been issued. It's an extreme zone. They were stopped by our authorised officers and taken into hotel quarantine. Yesterday, both of them tested positive. This is the risk of interstate travel at this point in time. This is why we have, the Chief Health Officer has declared Sydney and New South Wales as an extreme red zone. This is why we are putting such significant barriers in place to limit all unnecessary travel between our states at this most critical time. The consequences of these 2 positive cases not having been stopped turning positive in the community and then spreading on through Melbourne and Victoria are not, we do not need to see more incursions of the type we're already dealing with over the last few weeks. Over the last month, we have stopped 6,000 passengers at Melbourne Airport and at the airports. 190 of those have been put into hotel quarantine. 65 of those have been returned. So can I give a huge thanks to the authorised officers team and all the staff at Melbourne Airport for that ongoing vigilance. Daily we meet every single flight that arrives. Daily we check everybody who's coming in from a red zone or an extreme zone, and this is why we do it. As a footnote, and I stress it's a footnote, I'm pleased to say that both women are well. They're being well cared for in the hotel quarantine programme. We'll, of course, work on their recovery. Fines of $5,452 each have been issued for these two individuals. It also underscores our determination around doing all we can to support border communities. We are, of course, as the Premier announced yesterday, introducing a border permit that will be enforced from 6 p.m. tomorrow. The permit will be available from this afternoon online. It is a relatively simple online process. Again, I know it's so challenging now for border communities with the risks we see and the increasing number of cases we're seeing in regional New South Wales, but it is so important that we continue to manage those border permit systems and have a good sense of who's coming across the border and that those testing obligations are clearly in place. Finally, in terms of wider testing, 45,408 tests undertaken yesterday. We continue to see 97.8% of tests returned by the next day. We're averaging around 39,000 tests a day over the last week. So we're seeing a high level of testing over the last few days, and my thanks to everybody for coming out and getting it done. It is particularly important in those areas. We now have a significant part of the North Melbourne suburbs. We really want to see some good testing in, as well as Melton and Caroline Springs, and of course the ongoing exposure sites. We were busy in the west yesterday, but on average over the course of the day, waiting times are about an hour. As we always see, we are busiest in the morning, as we are again this morning. We are much quieter in the afternoon, so I'd ask people to check. And again, please make use of the full capacity across the day. And in terms of our western LGAs of Hobsons Bay, Wyndham, Maribyrnong and Brimbank, we're seeing around a 2.5 to 3-fold increase in testing activity compared to a week ago. So people are coming out in droves, the system is standing up, and we're all working very hard to get to the bottom of this outbreak. Finally, can I just recognise the pressures we have, particularly with our Western Health colleagues and Western Health at Sunshine and Werribee Hospital. We do have, as I said yesterday, a significant number of staff, frontline staff that are furloughed through the various exposure sites we're working on. It does mean, although the emergency departments at Footscray and Sunshine continue to be open for blue light cases, we are diverting where we can the less urgent cases to ensure we support our health services in total. A huge thanks to the staff at Western Health and at Werribee for their phenomenal efforts over the last few days. And it's a pretty tough when you're short-staffed. They're doing a magnificent job, as they always do. And more generally, can I urge all Victorians, as you interact with our vaccination teams, our testing teams across the state and all health services, please be patient, be kind. We're all here to make this. We're all here to get to the bottom of this. We're all here to get people vaccinated and to move out beyond this outbreak. And we very much appreciate and rely upon your support to do so. With that, the Minister and I will take any questions.
How many people were on that?
Mark.
How many people were on that flight, and are they all in quarantine now?
Yep. So there are 46 people who are on the flight QF471. They've all been contacted. They will all be going into 14 days of isolation. They will all, of course, be tested. And it's particularly, I'm sure there will be many cases on there. We've had many discussions at this forum around exemptions. There will be people there who travelled under exemptions to do something really important. It is of no fault to them that they were sitting next to people who were all likelihood infectious, and they will have to go into 14 days of quarantine immediately and undergo that normal testing regime.
Great that we've caught these women, but is it about time that we start checking for red zone permits before they leave Sydney? Because now we've got 46 more people potentially infectious, potentially out in Melbourne for the last 4 days. Yeah.
So look, firstly, Mark, it's an extreme red zone, so we don't see very many people travelling. Only with exemptions can they travel across. We have worked long and hard with airlines and airport authorities over the lengths of this pandemic, and we continue to implore and ask the support of the airlines, in particular the airport authorities, to undertake as much checking as we can before people get on flights. I appreciate it's very difficult. I appreciate it's an additional piece of complexity. Therefore, that we get what we get. That is why we do all the testing we do and the checking we do at the airport. So we are managing the risk at our end. I absolutely appreciate and sympathise with colleagues Interstate that they're all very busy as well. So we will continue to manage it in the best way we possibly can. But it is a frustration mark when we continue to see people coming through with the wrong documentation. With what 90 people moved into hotel quarantine, a whole heap turned back. It's a waste of everybody's time.
Jerome, what was their story? Yeah. People are going to be furious with these women. Yeah. What did they tell authorities?
I'm not sure. I haven't checked in with them. And look, there's I think, as others have said, there's no point getting angry, there's no point getting frustrated. We just got to do what we've got to do. I'm pleased that the system's worked. They work. That's why we have the authorised officers there. That's why the processes are in place, and that's why we've got a really robust quarantine system to manage them safely. What on earth they thought they were doing, I can only speculate.
The mystery case in Melbourne's inner north. The mystery case in Melbourne's inner north. Do you believe that's connected to the doctor who works at the Royal Children's Hospital?
No, I don't know. So it's a genuine mystery case, Samaya, but there are some social connections into some of the exposure sites. Again, this case dropped quite late yesterday afternoon, early evening, so we're still working through those interviews, but there's some initial, at least coincidental social connections that we're exploring. So I'm feeling pretty confident as I stand here that we'll find a way through that one.
How long were they symptomatic for, and when do you believe they were infectious?
I don't have the detail with me, but we'll list the exposure sites as we get them, and we'll make that clear.
Given that these two Sydney women had the wrong permit, why did we not send them back to Sydney?
It was a fairly late arriving flight, so it was a 5 p.m. flight that arrived on Monday, probably about 6:30, I expect. I suspect there was no returning flight to put them back onto, so we do try usually to put them back on. In this case, the decision was made on the spot to put them into hotel quarantine, and as I've indicated, that happens to a significant number of people. Look, and I'm glad we did. In this particular case, hotel quarantine was the best place for them. We'd have done nobody a service by putting them on yet another plane and back into the Sydney community.
Would it help if we tested people as a matter of course on arrival at Melbourne Airport if they're coming from a red zone or an extreme risk zone?
So we're exploring that, Rachel, at the moment, and we'll have more to say about that in the coming days around introducing some testing protocols, particularly for red zone arrivals, so not so much from New South Wales, but for red zone arrivals. So we'll explore that and see. We'll come and talk to you about that in the next few days. I think on this one, the most important thing is, are you eligible to be here? So we have a very tight testing regime for people who are entitled to come here. So people who travel on those very few exemptions have to undergo a testing protocol before they leave and when they arrive. Similarly, with those on permitted worker permits, there's a very regular testing regime in place. So we believe we have all those controls in place. We have all those controls in place. We are looking at whether we can do more on-the-spot testing at the airport as those people come in. But in this instance, this is why we have people to check whether they're entitled to be here. They're not. There is no right of travel, I'm afraid, from New South Wales into Victoria. The only routine is through exemptions or a permitted worker scheme, and those are very tightly controlled.
And just on unlinked cases, is that now 7 unlinked cases we've had? We had the 2 outbreaks last week that we haven't got to the bottom of. We had 2 yesterday, and we've got 3 today, at varying levels of us possibly discovering where they've come from. But how concerning is that we've got?
Oh, look, I think on the board at the moment, Rachel, the way I look at it is absolutely we've got the source of the Hobsons Bay cluster. Now, what we're confident about is that the school outbreaks we've talked through, the pivot to Caroline Springs, the pivot into Melton, they're all, and the pivot into social housing, they're all downstream from Hobsons Bay. So you're right, we don't have acquisition sources yet for the couple who kicked that downstream one off. That is a matter of concern for us, and we continue to do a lot of work around it. We know that genomics isn't giving us a precise answer, but it's giving us a very strong indication that it's very much associated with that Sydney exposure, either through the city of Hume or another incursion that we have not yet identified. That's the major concern at the moment. The ones from yesterday, I think, are starting to come into place, and I think we'll land them pretty cleanly. I think we know enough about where that's going on. Today's issues, I am concerned about Glenroy, so that's the one I'm most concerned to get more information and more detail. That's why we're going into the school, to get more understanding of acquisition there. And I think the inner north one, I think we'll land that one pretty easily in the next couple of days.
And Maribyrnong last week, I know you were working on a theory that they were connected to a family who'd returned from hotel quarantine in New South Wales. Where are you at with that work?
Yeah, so we've done a lot of testing of we had 2 people who travelled in from Interstate earlier in July, middle of July, 16th of July. I think the view of our epidemiological experts at the moment is that those were past infections. They are not likely to be the initiating case for the cluster we've seen in Inner-City Maribyrnong. Go over here and I'll come back to you.
With the border exemptions and permitted workers, do they have to get tested before they get on a flight?
Yeah, so on the permitted worker scheme, you have to go through a testing regime before you travel, and then a regular maintenance testing cycle that you go through. It's a bit different for different trades and different categories, but there is a regular testing regime you have to go through. Again, with red zone arrivals, they come into a quarantine system that doesn't include New South Wales. Exemptions are all dealt with on a case-by-case basis, but the principle for all of the exemptions is that there will be a testing and isolation component to them.
Why weren't they tested prior to setting off?
Sorry?
Why weren't they tested prior to setting off in Sydney? Have you spoken to your counterparts in New South Wales?
We've spoken to our counterparts in Sydney, and these people are not on the radar, I believe, of the Sydney health authorities. Of course, they're pretty busy. They've got their hands full with probably more pressing things. Look, these people should not have left in the first place. Let's be very clear, and I think our colleagues in Sydney would absolutely agree with that. They should not have left in the first place. It is a moot point as to whether they should have got tested. They should never have gone to the airport.
Are you frustrated that the issue in Sydney is really creeping over to Victoria now when we've got people coming in who weren't even authorised?
That's right. Yeah, look, and that's exactly the conversations we've been having, in this room and others over the last 5-6 weeks now, where we've seen a growing level of pressure within the New South Wales pressure cooker. We're seeing more cases build up day by day. We've seen that expansion from Greater Sydney into some parts of regional New South Wales, and that is why we continue to adjust our border arrangements and our border controls. We put limitations on right back into the middle of June about not travelling to New South Wales and discouraging travel in, and we've consistently stepped it up, and I think ahead of the growing risk that we're now seeing in New South Wales.
So what was the permit that they travelled on?
Yeah, they travelled on a completely invalid and inappropriate green zone permit.
And why are you so concerned about the cases in Glenroy? Is it because where they potentially could have contracted it from, or where they potentially could have transmitted it to?
Yeah, look, both reasons, Samaya. So, look, as I said to Rachel, we're concerned that we don't have acquisition sources for these Glenroy people. So, normally in an outbreak at this stage, you'd want everybody to be part of your primary close contact field. You know about them. They're all isolating, and those numbers are starting to solidify. So seeing something pop up that's not on the radar yet is a little bit disturbing. That's the primary issue. Of course, we'll also want to look downstream. Our understanding from them is that they're quite recent in their infectious period, so recent showing of symptoms. So there's more work to do over the next day or two to really get to the bottom of it. But right now, I don't have an acquisition source. All the other pieces, we can see how they fit in. These two don't yet fit in.
We've had wastewater detects.
Rachel, I'll come to you.
Might be the same question. We've had wastewater detects in that Glenroy, Broady-Jacana area for more than a week now. Does that indicate to you that there is possibly undetected transmission for more than a week there?
Absolutely, and we've called out these wastewater detects a number of times. Look, we know wastewater is not it's not a perfect ground radar, but it's a useful canary in the coal mine that says something is slightly afoot and something's not quite right. We do a lot of matching when we see wastewater detects in new areas around recent return, people from hotel quarantine, red zone arrivals, people who are still shedding virus. But this area has been of increasing concern to us over the last few days. Seeing now 3 people across 2 different households turn positive in Glenroy gives us some explanation of all that, but of course we want to know where they got it from.
How are you investigating the connection perhaps between these 2 households? Do they go to the same supermarket, or is there any link at all?
All those options up for grabs. So we've got two separate families in those 2 households. We're not aware at this stage, but again, we're less than 24 hours in. A lot of conversations to be had, a lot of movements to be explored. We don't believe they know each other. The children go to different schools. There's no obvious social overlaps at this point in time, but we'll work on that over the next few hours.
Mary Valley traffic controller, is that still a mystery case?
No.
And
Okay. Yeah. No, that's been I think I mentioned that last week. That's been formally linked into the previous cluster.
The pupil at Glenroy West, was he attending school at all while infectious?
So we believe there may have been one day where he was attending school while infectious. We are taking, again, a very precautionary approach to regarding their infectious period, but we believe there might be one day where they were infectious.
Which day was that?
I don't have that in front of me. I think it was a Thursday last week.
And
last day schools were open.
Just on the Moonee Valley case, have you now linked that to cases who'd gone through the testing centre, and have you established whether there are any infection control breaches involved there?
No, well, clearly there was, because we've never yet seen, or we have never seen any transmission of the virus at any of our testing stations over almost 18 months of fighting this pandemic. What we saw at Moonee Valley was there was a breach of infection prevention control. A number of parties using a toilet block. There was an overlap, and that should not have occurred. That's now been dealt with with all of our other testing sites.
So to clarify, was that people getting tested and staff using the same toilet?
That's right. Yeah.
And just really quickly on testing, there's a lot to criticise about New South Wales's approach, but one thing they seem to have been getting right is lots of testing. They're having 100,000 people get tested a day.
Yep.
Their population isn't much bigger than Victoria.
Yep.
We're considering 40,000 to be a good number. Should we be aiming higher?
Well, no, I think, look, in the first instance, I would never seek to comment on another state and how they're fighting the pandemic. We've all got our own jobs to do. I think, secondly, we look at it in situ. We're dealing here in Victoria with 20 cases a day, a total of 137 active cases, and a very targeted set of exposure sites, 330 exposure sites, well-defined areas where we need to be seeing more testing coming in. And look, it's about, as we've always done here over the last year, it's about targeting our testing at where we think the virus might be and ensuring we get the cooperation of the Victorian community. So I'm comfortable with the testing activity we're seeing on the ground. I'm comfortable with the testing performance we're seeing. I would absolutely love to see over the next 2 days, particularly people in the northern suburbs, really coming out and getting tested in numbers, because we've got a whole range of vague signals that we need to get more of. I want to continue to see the Melton community come out to get tested and continue strong support in Caroline Springs. But our testing numbers are holding up well. And I would point to 98.7% of our tests in the last 24 hours are coming back the next day. So if you get tested today, you will have your result tomorrow. There's not many places that can say that.
As you mentioned, testing rates in the western suburbs have increased by threefold. Are you comfortable with the level that it has increased to?
Yeah, pretty. I think based on what we're seeing and based on the targeted exposure sites we're working on, we're comfortable. But look, this is the requirement for people to come forward and get tested never really goes away and won't go away for months until we're well past that 80% vaccination point. This is not just a matter of people in those exposure sites and in those primary close contact fields or those who are isolating. It's about all Victorians saying, I'm feeling symptomatic, I should go and get tested. We only found the guy in the inner north, the people in Glenroy, because they were symptomatic. That's how we found them. It was them coming forward and doing the right thing that allows us to identify that risk and then to manage it. That's what all of us need to continue to do. It doesn't just go away.
And vaccination rates have increased over the past couple of days. Have you been able to project when we might be able to hit 70% if we continue at the rate we're going?
No, so I think there's a number of announcements we'll make in the coming days around other measures to really start to mobilise our vaccination response and vaccination effort. Said already this morning, 250,000 vaccination appointments already in the system that have been made, and that's fantastic. So it's 250,000 Victorians getting on with their vaccination journey. I've got 240,000 appointments left to hand out over the next 4 weeks. I'd love to see those being taken up, and we'll have more to say about that in the coming days. So my expectation is that over the next 3 or 4 weeks, we see a significant increase in the vaccination rate here in Victoria as people come forward and they continue to go to their GPs. I don't care where you get it done, just get it done. And I think then we'll be able to have a better projection of when we get to our 70% and 80% thresholds.
And Pfizer was open to kids this week at state-run clinics. Do you know how many kids have either made a booking or how many have been vaccinated?
Kids in terms of?
12 to 15-year-olds.
I'll come back to you on that.
Other states opened up their Pfizer to younger cohorts. I know that you said that we can't do that at the moment because of supply, but when do you expect we will be able to do that?
In terms of the younger cohorts?
Just under 40, I think.
Under 40.
South Australia.
Yeah, that's right. That's right. Look, we'll ultimately, I think at the moment we're holding with the national program and the COVID Shield program that General Fruin's laid out. And look, and can I just say, I think it's been really good to see how that program has stepped up again in recent weeks. We're of course now getting to the space where we can see September ahead of us and we can see that increase in Pfizer becoming available. We'll continue to work with our national Commonwealth colleagues around what's the right time to drop those age barriers. We want everyone to get vaccinated as soon as we possibly can, and if we see any delay in people coming forward, then we'll certainly recommend what we need to do.
Have we been given an indication of exactly when we'll be able to ramp up vaccinations with Pfizer for young people? So September we're eligible. Is that from September 1 we're opening up?
No, there's no decisions been made yet, Julia. And again, at this point in time, it's a national programme decision around when we open up vaccination to those under the age of 40. Look, we've still got, although we're seeing really good progress in the older age groups, of people really getting their vaccinations done. Again, we've got 250,000 vaccinations done, bookings made, we've got 250,000 to go. We should get really good representation from those of us over the age of 40 to come forward and just get it sorted out. We've got Pfizer bookings available, we've got AstraZeneca bookings available. There's really no excuse now not to hit the system and to start to make your appointment.
Given there's no
For Pfizer for young people?
Not at this point. Mark?
Given that 40 to 60-year-olds have had the option to get Pfizer for a while, are we seeing a slowdown in them presenting? Why do we have so many Pfizer appointments available?
Oh, look, Mark, we don't have that many available, but let's be clear. We were allocated 150,000 Pfizer doses as a bring forward, recognising the outbreak we're going through. There was a rephasing of the national programme to allow that to happen. I think some early deliveries came in. That's already welcome. Those are all part of that. That's part of that, that slug of appointments that's available. They've not all yet been taken up. We've also been able to harvest some more vaccination appointments, some more Pfizer appointments by really efficient use of the vaccine doses that we've been allocated. So we're making available what we can. I'm not seeing, we've seen really strong bookings over the last few days. I think people are kind of recognising now that, 2 months ago we were in a land of, in a land of famine where there wasn't much vaccine available. We're now heading to a space where we can start to see more becoming available. And in September, we're seeing more available. So people now, if you've been sitting on the sidelines saying, well, it doesn't sound like there's much out there and it's probably not worth me giving it a go, increasingly now, those appointments are becoming available. I expect to see more become available in September and October. So we already just start to orientate ourselves towards getting it done.
Do you think it's time to recalibrate the national vaccination program? Given what we saw in Victoria's second wave last year and in New South Wales right now, most of the cases are being transmitted through younger people. And I know vaccination doesn't completely eliminate transmission, but it still reduces that risk.
No, it does, Samaya, and I think but I think if you look at the volumes of vaccine, the Pfizer vaccine, the Moderna vaccine that started to become available in the coming weeks, we're really not far away now. I think the bigger question is at what point at a national level do we drop those age eligibilities and just bring people forward? Now, that is a matter for the Commonwealth around what's the strategy for going below 40, and we'll work with them over the coming weeks to work that out.
Who are eligible for Pfizer now aren't snapping up all the available appointments for Pfizer. Is it time that we open it up for people who do want
I don't think we're at that point yet.
vaccinations?
Oh, sorry, Julia, I interrupted.
Yeah, time to open it up for people who want those vaccinations.
Look, I think that I don't think we can make that call yet. I think we've, in the last few days, last week, we've opened up a significant number of appointments. I'm seeing a significant lift. We did, 25,000 vaccinations yesterday. That is people jumping on the opportunity and coming forward and getting it done. That's a lot more than we were doing a week ago and 2 weeks ago. So I think that lift up is really good. My call out today is, it's great to see more people coming forward. It's great to have 250,000 appointments in the bank going to be delivered over the next few weeks. I now want to see more people taking up the opportunity, both with AZ and with Pfizer.
Just to clarify, is there a reason, can we check permits at Sydney Airport, given how high risk that environment is, before people get on the plane?
People at Sydney Airport can check permits at Sydney Airport.
Is there any way of working with the New South Wales government to do that?
I think they've got their hands full at the moment.
Wouldn't it, given
airlines do it?
No, so Mark, and in fairness, Mark, you asked this question at the beginning. We have had many conversations over many months with Melbourne Airport and with the airlines, and look, we appreciate they're under huge pressure. Who would want? It's a really challenging industry, hugely problematic at the moment. Our best endeavours so far have not resulted in the airlines undertaking significant checking of people's entitlement to travel before they board. That has always been a source of some frustration to us. That's not something that I can fix. It's something that's down to the airports and in this case, Sydney Airport and others to go and arrange. And I recognise they've got competing demands on their time, but that's not something, we've tried, we've asked, hasn't happened.
Could we send health department personnel to Sydney Airport?
I'm not sending health department people to Sydney. I mean, we've said to Victorians, please do not go to Sydney and New South Wales at this point in time. We've not been asked to send people to go and do so. And look, the controls we have at Melbourne Airport are clearly working well because we're catching or dealing or asking, interviewing 100% of arriving passengers. Have they got the right entitlement? We're sending a whole heap are being turned around. Some others are going into hotel quarantine, and the 2 positive cases show that why that control is so important.
Do you know which LGA in Sydney these 2 women were from?
No.
Just on that 100%, the 6,000 that you said have been stopped from red zone arrivals, over what period is that, just to clarify?
That's 4 weeks. I think the numbers I gave out earlier, if I can find my notes, which I can't. So over the last 4 weeks, over the last month, 6,000 passengers handled over the last month. 190 went to hotel quarantine, 65 were turned back.
And that's 100% of people coming from red zone?
100% of people coming from red zones and extreme zones.
And what we're talking about, Interstate, Canberra is about to go into a lockdown. What will that mean for federal MPs returning from Parliament? Will they be subject to the same requirements as everyone else, and what will they have to do?
I'm not a federal MP, so I don't really know. The Minister might comment, but no, that's a challenge. We've had a number of conversations as we've taken we've taken a line on this over the last 6 weeks, which is about how do we protect Victoria most effectively. We had Canberra at red zone for a significant number of. We've had Canberra at the red zone for a while for this very reason, because we were worried about the risk to Canberrans and to ACT of spread from regional New South Wales and from Sydney. I can't speculate as to what position they're going to take. I've not followed their media announcements this morning, but I know they'll do everything they need to protect Canberrans from the wider threats around New South Wales that we all face across the eastern seaboard.
What about Victoria in terms of Victorian federal MPs returning to Victoria? What are their quarantine obligations?
They'll be the same as anybody else returning from the ACT.
What about returning Olympic athletes? Will we be doing anything like South Australia, getting them to do quarantine here as well?
Not that I'm aware of, but we'll come back to you on that.
So does that mean that federal MPs won't be able to come back from Canberra because it'll be an extreme risk zone like New South Wales?
Certainly, anybody who, if in the event that there are changes to the ACT, will then make, the Chief Health Officer will make whatever appropriate decisions around how we treat people coming back out of Canberra. At the moment, it's a red zone. If that changes, we'll let you know.
Caroline Springs, are you feeling more confident about that than you were earlier in the week?
Look, I think there's still more work to do on Caroline Springs. We've seen 3 more positive cases come out of household contacts. The good news is we're not seeing any more positive cases come out of people who've been directly in that shopping square. So that is encouraging. But I'd like a few more days of having a really good dig around in Caroline Springs. Really want to see people getting tested. I think we've seen a really good turnout from the staff who are now isolated. So the Tier 1 status for those staff who worked at a shopping centre between the 2nd and 5th of August, but I'd like to see those results before we start to relax our focus.
Did you end up linking those 2 cases that were in the centre to any specific shops, or is it just a case of fleeting transmission?
Which 2?
At the Caroline Springs shopping centre?
So the ones we've identified today in Caroline Springs are household contacts, so they're known household contacts.
Yesterday, there was the 2 cases, and it was the day before, and we were saying maybe they went to the same bathroom as a case. We didn't know if they'd been to a shop.
Yeah. You know where.
Yeah, look, I think there's been a number of exposure sites within Caroline Springs Square shopping centre. Certainly, we've seen some transmission, I believe, at the public bathrooms that have been used by a number of different cases, and within 1 or 2 of the stores that we've listed on our exposure site.
Gerard. There are even more mystery cases today. There's been some reporting as well that discussions are underway in the government about whether even another week of lockdown is needed. Do you think that the government needs to be more transparent with Victorians about what could be ahead?
There's no conversation going on at all, apart from the lockdown that we're about to start. We're about to start the 2nd week of our lockdown tomorrow. There's no other conversations going on in government, in public health, at all.
Do you believe at this stage, given the lay of the land, that a week will be enough, given we've got these
as we always say,
mystery
this is a day-by-day proposition. So we have seen on this outbreak, as we've seen on previous outbreaks, you have days where it's coming together into sharp relief, and you can start to see you've got control over all the pieces. Today we've got Glenroy to process and to manage to make those connections in. That will make us feel a lot better. It may be, to Rachel's earlier question, that we never get to the source point, the acquisition point for the Hobsons Bay couple. That is now quite a few weeks ago. We are not seeing any other, save Glenroy, we're not seeing any other chains that are starting to emerge that would be downstream from this. That gives us a little bit more confidence, but we've got Glenroy to work through. We've got a long way to go before we get to next week. And as we said the other day, 24 hours is a long time in a pandemic. 7 days is an eternity.
Gerard, going back to last month, there was a flight from Sydney to Melbourne. Yep. That was listed as a potential acquisition site. Have any cases come from that, and can you just explain how that fits into the broader investigation?
So is this the Sydney-Melbourne flight associated with the Tasmanian case? The
I think so. It was a Qantas flight, July 15.
Yeah, I mean, I'm good at my flight numbers, but I might not have all the details on that one. The one I'm aware of from last week is certainly a Sydney-Melbourne flight that was associated with an individual who was travelling onwards to Tasmania. They were returned from Tasmania and they flew directly back from Launceston, I think it was, straight back into Sydney. We've done a full contact trace on that flight because we did list them last week. No other positive cases have been identified from that flight.
Was the July 15 one related to that New South Wales hotel quarantine family, perhaps?
It could be actually, Rachel, that's right. So the other flight that we were catching was indeed the one from New South Wales. Again, we've traced all those passengers. No other cases have come from there. And again, as I said earlier, there is a feeling that although those people were positive, so the 2 people came positive, it might be an older infection because we identified it through serology.
And just back on the Moonee Valley traffic controller, have you investigated who was responsible for that infection control breach, and have they faced any consequences? Yeah,
look, we've worked it through with the site team and with the management team involved. It is one of our centres that we manage directly. Corrective actions have been identified and have been taken. There's no punitive regime. The team understands very clearly what the risk was. That's now been dealt with, and we've revised our procedures for that.
So there's no disciplining or formal warnings or
no. Look, we have got literally thousands of people across our testing centres, our vaccination centres, in our health services, busting a gut to make this all work. So going in and penalising people because one thing which was not seen as a problem has become a problem is not what we do.
So the breach is that people getting tested are obviously not able to use the bathroom that's designated.
Correct. And that's always been a protocol we've had in place in all of our testing centres. There was an error of judgment made in this particular case. That's been dealt with.
So can you just confirm how many in that cluster? Do you have that number on you?
Which cluster?
The traffic controller.
God, if you want to have another whole briefing on the traffic controller, I can get my notes out from the last 2 weeks and give it to you. I don't have the details with me. What I can say is a traffic controller was clearly connected up into that wider aerial apartments, MCG, Amy Park kind of network. It's all part of that. We identified the source of infection being people who were tested at that site. Somebody left their car, went to the bathroom, crossed over with another member of staff. That's how it occurred.
Have you ruled out any onward transmission from the traffic controller
absolutely.
cluster?
We did. Look, and the traffic controller did the right thing. There was another traffic controller involved who did a car share. That was quite appropriate. So it ended up, I think, being 2 or 3 cases. We went exhaustively through all of their social and household contacts. There were quite a few exposure sites that we listed at that time. They've all been dealt with.
So definitely no link between them and the Hobsons Bay couple?
No link. No. It would be easier if it was, Rachel. I'd be delighted if that was a link, but we haven't found it.
Can I ask the Minister? Sorry, Marty.
Thought you might have forgotten I was here. Before you ask, I just wanted to say one thing. I had my second shot yesterday, and my wife and I had appointments. There was quite a lot of people in front of us when we got there. I've never been happier to see a queue. The turnout was really, really impressive, and the staff at these state testing centres do a fantastic job. And I would say to everybody watching, there's nothing like the peace of mind of knowing that you're 2-shot vaccinated. It's a great feeling. So, and AstraZeneca, by the way. So, if I could just give a shout out to everyone who's thinking about it, just go and do it.
So we've had a few major events cancelled because of this lockdown. Is there any support available for them, or how's that sort of process working?
Well, we deal with the major events. We deal with the organisers one-on-one. I'm not sure which ones you're talking about as a result of this lockdown. I mean, we had an announcement a couple of days ago about the air show, which would be later in the year. That's much more about, apart from capacity restrictions, it's about the ability of, Defence Force personnel, the RAF and others to move safely and freely across state borders. And I think a judgment's been made that that's just a bit too difficult to predict. So that's been cancelled. Look, major events, being cancelled, whether it's the Ekka in Brisbane, the likelihood, I suspect, that the NRL Grand Final might be elsewhere this year. It's a really regrettable but unavoidable part of dealing with a pandemic. We put on the ones that we can, and we should cherish them. Whether it's the Australian Open or the Warrnambool May races, the ones that you can get away are fantastic, but there are others that unfortunately happen to fall during outbreak periods and they become very difficult. We talk to event promoters one-on-one. So for instance, I think we had some direct discussions with the promoters of the Rising Festival and some of those others about what support we could provide. I've already indicated that we're looking very closely at an event insurance package, as are our counterparts in New South Wales, and I think at some point it'll be appropriate for Stuart Ayres and I to both have a conversation with the Commonwealth. I met with the live theatre industry the other day. They're certainly very keen on a package of that sort. So we're looking at that. And there are the live performance support initiatives that are managed by Minister Pearson, which there's already been support through one round of that and the second round of that, which has been announced and is about to open.
Just on that, live venues and live theatres, they're at the moment not eligible for the licensed hospitality fund. That's $7,000. They are eligible for $4,000. Do you think it's time to allow them to also apply for that licensed hospitality venue fund?
We'll look at that, but the live performance support package is up to $7,000 for an event, a live music event that gets postponed, and I think up to $2,000 for suppliers into that event. But if you're a licensed venue with seating and with the capacity to serve meals, then you may well be eligible for the licensed hospo fund. So I think there's a bit of some venues may be eligible for both, and they have to choose which one is more beneficial to them.
And given a lot of regional businesses rely on Melburnians, will there be any extra financial or business support for regional businesses, even though they're obviously out of lockdown?
Yeah, well, look, I think if you asked any of those regional businesses whether they'd rather be open or receive a $2,800 BCAP payment, which the metro businesses are receiving, I think they'd rather be open. We did though, when Minister Pulford and Minister Pallas and I were here a couple of weeks ago, it feels like more than that, we did announce that restart package, which was available to everyone across the state, and that's been largely paid. That was payments of up to $5,000 for those businesses in those industries which were still subject to some sort of restriction density quotient, so hairdressers, gyms and businesses of that sort. So they're getting that money, and I also indicated earlier today that the increase from 8,000 to 10,000 in regards to the Small Business Hardship Fund, which Minister Pulford's managing, that applied to both metro and regional.
Just on business. The power that the government has to compel businesses to do things. Obviously, we can ask them to lock down. We can ask millions of people to lock down. Does the state not have power to enforce the airlines checking these permits before they come here, just as another protection for the border, or is that a Commonwealth matter?
Well, the airlines are regulated by the Commonwealth. I mean, most of the airlines that you talk about are not actually, they're not Victorian-based companies. So Qantas is a Sydney-based company, Virgin's a Queensland-based company, and aviation is regulated by the Commonwealth. Having said that, I wouldn't be surprised, I don't know this, I wouldn't be surprised if it becomes a subject of discussion at a National Cabinet meeting. But as Jerome has indicated, the ability of the Victorian government to enforce outcomes or regulate what occurs in airports outside the Victorian jurisdiction is extremely limited.
So I asked Jerome, I'll ask you as well. Has any consideration been given to Olympians doing another round of hotel quarantine here?
No, not that I've heard. I'm only even aware of this issue because I've read about the situation in South Australia. My understanding, I'm not responsible for quarantine arrangements. My understanding is if a quarantine is served in another jurisdiction, we have, and I'll look to Jerome, we don't traditionally require them to serve another round of quarantine, provided they do all the right things in terms of how they move from their hotel directly to the airport and directly here. So that's not been something that we've enforced, and I have there's no sense from anything I've heard that we are going to require that of Olympians.
Minister, just on CBD businesses, obviously coming in and out of lockdown is especially tough for them. Probably people didn't come back to work in between the last one. Are you guys looking at maybe like voucher schemes or other incentives when we can open back up? So
you might recall a couple of weeks ago when we announced the restart package that we provided a supplement for those CBD businesses. So that is being paid. Beyond that, we announced that $200 million CBD revitalisation fund at the time of the budget, $100 million from us and $100 million from the City of Melbourne. I had a conversation with the Lord Mayor last week about how some of that funding will be spent in the first tranche. I'm not in a position to make announcements today, but it would be fair to say that the Lord Mayor and the City of Melbourne are keen on the Melbourne money vouchers. I think they saw them as a great boon to the CBD, and interestingly, the accommodation providers thought so as well. It seems like a number of people who chose to come into the city for dinner also stayed the night. That's great. It's a great sort of leveraging of that support. So we are in discussions with the City of Melbourne about the sort of first spend out of that fund, and it's fair to say they're keen on that. Obviously, that's a conversation we should have when restaurants are open rather than when they're closed.
Can I just confirm that all the additional business support you announced today will be automatically provided to businesses that have already been eligible?
Not all of it. So the business cost assistance program funds will be paid automatically, and I should say, you might recall, I think when we announced the June support that we reopened the BCAP for those who hadn't previously applied in May. A number of businesses have applied since and been approved. So it's not just the original tranche, but it's anyone who's been approved since. And there were, some 4,000 or 5,000 so far. In additional businesses have been approved, so they'll all get that automatically. The licensed hospo venue fund businesses will be paid automatically. But then there's 180 million in the small business hardship fund, which is by application, and those applications open today.
And when do you think the licensed hospitality fund and BCAP, when will the money actually get into the businesses' bank accounts?
From what's been announced today?
Yeah.
Well, we always aim to get that money out the door within the week, and then it's about which bank you're with. So if you're with if you're with some banks, it'll be with you overnight, and if you're with other banks, it can take up to 5 days to hit your account.
Minister, are you able to confirm the total amount that's been spent on business support during the pandemic?
It's somewhere between, in terms of Victorian government money, it's somewhere between $7 billion and $8 billion.
And can we keep doing it if we keep going in and out of lockdown? I mean, no one's suggesting that you shouldn't, but will that kitty run out?
Well, no, we will continue to support businesses as we need to. As for how much of a strain it puts on the state treasury, that's probably a question you need to direct to the treasurer. I've got no doubt it puts a substantial strain on the treasury. I think I indicated at a press conference a few weeks ago that I think the entire state budget for a year is in the vicinity of $75 billion. So, $7 to $8 billion over a 15-month period represents a pretty significant share of the state budget. But having said that, the last 3 rounds of payment have been possible because we've been sharing that burden with the Commonwealth, and that is something that we are extremely grateful for. And the packages that we've announced over the last 3 weeks, we would not have been able to do without that Commonwealth support. So we're certainly very grateful for that, and we would hope that it would continue.
Minister, some Melburnians in regional Victoria that have decided to stay on pre-lockdown aren't getting some services. The declaration form, they have to be there for emergency reasons, work. Holidaying isn't one of those reasons. Is the only option they have to return home?
Look, I'm not fully familiar with the way that system operates. You're talking about people who were in those regions before the lockdown commenced. I don't know if Jerome has anything he can add. I think Jerome might be. Do you have anything more for me before we throw back to Jerome? All right. Jerome can see us out. Last run.
Look, I think certainly if there are people if there are Melbourne-based residents who are not normally regional Victorian residents, then I'm afraid you need to be back in Melbourne. The easing of the conditions in regional Victoria is to enable regional Victorian communities to continue to open up. We've put very strong requirements and expectations on regional communities to ensure that we're not seeing people from Melbourne inadvertently or advertently travelling up there and accessing services. So if you're not a regional Victorian resident normally, you should not be in regional Victoria.
Just got one question about an exposure site in Cheltenham. It's a furniture store there.
Okay, yep.
There's not many cases or exposure sites out in the southeast.
Yep.
Did a case visit there, or what's the situation?
Yeah, I'm not aware of which case visited which furniture shop in Cheltenham, but there will have been an exposure of a case in that area. And as I said yesterday, we are still seeing some wastewater detections out in the southeast, particularly in the Keysborough area. So please do not think this is something which is only an issue for the northern or western suburbs. This continues to be a significant exposure. We've got over 120 or so active cases associated with this current cluster. Got multiple schools, multiple movements. That's why we went to lockdown. It's really important that we use these few very expensive and costly days for all Melburnians to get to the bottom of it. So if you've got symptoms, wherever you are, get tested.
What's our R0 value at the moment? Our R0 value?
I don't know. You'd have to ask the Chief Health Officer, Rachel.
Sure.
Any other questions? No? Good. Thank you all very much. Thank you all. Thank you.
59 minutes.
Yes, we both need to. Yeah. I didn't hear that. I was embarrassed last time. I thought now I'm like.